So, medication is sealed onto your teeth that have the periodontal pockets on the exact site that is inflamed and has the disease. And since it's sealed underneath the perio trays, it allows the hydrogen peroxide to seep deep into the pockets where toothbrushes and water picks cannot reach. And this way it really seeps into the gingival sulcus and allows for the medication to be activated and get deep into the bacteria and allow for destruction and tissue rejuvenation. Now, side effects to this, you only have whiter teeth and fresher breath. And this is approved by the FDA and ADA because all the medication truly is hydrogen peroxide. Now, initially how this hydrogen peroxide works is it seeps into the gums, and when it comes in contact with bacteria, it causes the cell walls to rupture, therefore causing lysing of the bacterial cells. Secondly, when hydrogen peroxide is released into the tissues, it releases a large amount of bubbling. And what this bubbling does is it allows for the old bacteria tissues to degenerate, and new bacteria that is a part of your normal healthy flora can repopulate within your periodontium. And this allows for a healthy, sustainable environment for your normal oral flora. Now, the results are that over a bunch of research, it has been found that oral pathogens have been reduced by 90%, and there's a 75% reduction rate among patients using the Perio Protect. And so far, 100% of patients say they would recommend to a family member or a friend. Now you might be wondering, is this product for you, or maybe should you go with a more invasive surgery? Well, if you answer yes to any of the following questions, then maybe you should consider getting the Perio Protect trays. So, are your gums inflamed, bleeding, or bright red? Are your teeth sensitive? Are they very loose? Are you experiencing gaps between your teeth, and do they seem enlonged? And do you want to have whiter teeth, fresher breath, and preserve your overall health? If you answered yes to any of these questions, then you are a very good candidate for using the Perio Protect trays and seeing a lot of results. Now, Dr. Keller was very interested in how bacteria affected the gums and the rest of your body, and he found that the gums are the direct pathway to your blood system, your heart, your lungs, and all of your vitals. Now, on your teeth, there are bacterial clumps known as biofilms, and these biofilms can break off and get into your blood system and into your vitals, your heart, your lungs, your brain, and this is known as the seeding effect. Bacteria place little seeds and get into your vitals. Now, research has identified pathogens that come straight from gum disease, and they cause a lot of systemic inflammation and diseases such as diabetes type 2, respiratory disease, Alzheimer's disease, and they can even cause preterm and low-weight babies. Now, through the use of these trays and a lot of research, it has been determined that a lot of individuals have seen a reduction in these diseases, which is pretty phenomenal. Since the treatment is used in between home care and office visits, it is pretty much up to you to control your direct outcome by setting a set schedule and being able to have substantial improvements within 10 minutes in one day. Now, some common questions are, how much does it cost? And this is based upon your provider and approximately how much medication you will be using. Another common question is there any pain? Is it very invasive? And the answer is no, there is no pain, there is no scalpel, and there's no invasive procedures that go in. All you do is wear this tray for a few days and you'll be feeling better.